Hello, my name is Aoife Black. I'm a GP in Derry in Northern Ireland. I'm doing a diploma in diabetes through the University of South Wales, and this is my video for patients. Blood vessels of all sizes can get damaged from uncontrolled diabetes. High glucose can add to the stickiness of the blood, and when this is combined with high blood pressure and high cholesterol, it can cause hardening of the large blood vessels and end with heart attacks, strokes, or peripheral vascular disease. If you have diabetes for a long time and it's uncontrolled, you'll be at increased risk of heart disease and strokes. People with diabetes are more likely to die from heart disease than those without diabetes. If you have uncontrolled diabetes, this doubles your risk of heart attacks and strokes, and it may develop at a younger age. Diabetes for a period of 10 years, when it's not controlled, is the same risk of having a heart attack or stroke as if you've had a previous heart attack, so it's quite significant. Unmanaged diabetes can lead to the complications. Women with diabetes are at increased risk compared to men with diabetes. Heart attacks and angina, women are 44% more likely than diabetic men to suffer these. Likewise, for strokes, women with diabetes are 25% increased risk of stroke compared to men with diabetes. This may seem unusual. Women are usually seen as lower risk than men for these conditions. It may be that for women, the diabetes can come about at a higher weight compared to men, so perhaps they've accumulated more cardiovascular risk factors like blood pressure and cholesterol by the time the diabetes develops. If you keep your diabetes well managed, you can avoid heart disease and strokes. So let's have a look at what matters when it comes to your personal risk. The A, B, C, D, E of modifiable risk factors. Identifying your risk factors is the first step to prevention. Some risk factors like family history we cannot change. There are other lifestyle factors that we can. You should discuss with your GP your personal risk of heart attacks or strokes. And from there you can discuss a personalised plan for prevention. Risk assessment must take into account the major risk factors. A, HbA1c, elevated blood sugars. B, elevated blood pressure. C, raised cholesterol. C, also cigarette smoking. D, diet. And E, exercise. Physical inactivity should be addressed. The combination of this could be also addressing excess body weight and central obesity. So lifestyle changes should be addressed. Remember that your health professional is there to support you to adjust to diabetes and to help you feel physically and emotionally better. Bringing about change should be tailored to you as an individual, and you need to discuss what works best for you and your daily life, because making changes shouldn't be too difficult. A for A1C, your average sugar. The higher the number, the higher the glucose. High levels of glucose in the blood can be harmful for the heart and the blood vessels. Keep your appointments, find out what treatment for your diabetes suits you best. How tightly controlled your sugars are should depend on your age, your disease duration, and whether you have other illnesses as well. B is for blood pressure. High blood pressure makes the heart work extra hard. It can also damage the vessels, increasing your risk of heart disease and strokes. So blood pressure as a diabetic person should be below 140/90. Often we're aiming for a blood pressure of 130 millimeters of mercury. If your blood pressure is high above 140, every 10 millimeters that is reduced by will significantly reduce your heart attack, stroke and risk of death. So keep a check on it. It's usually every 6 months, but it can be more frequently if needed. Very important to look at the salt in the diet and the alcohol. Alcohol should be within healthy limits of 14 units per week. That's the equivalent of 7 pints of beer or 1.5 bottles of wine as a maximum over the whole week. And again, weight loss will help with the blood pressure control also. Diabetes and cholesterol is very good to to talk about your own cholesterol levels with your doctor and find out the breakdown of HDL, the good cholesterol, which can be boosted by eating healthy fats in the diet and also by exercise. HDL is protective for the blood vessels. The LDL is the unhealthy cholesterol, which is associated with clogging of the arteries, and avoiding unhealthy saturated and trans fats will also help to control your cholesterol, and we'll talk more about dietary choices. If lifestyle alone doesn't work to control your cholesterol, then you may be put onto a statin tablet. Very, very effective tablets. There was a study done of 1,500 patients who had diabetes and coronary heart disease and very high levels of LDL. Starting them on a statin significantly reduced the rate of any major cardiovascular events by a big 25% just from being on the statin tablet, so they may be recommended for you. See, cigarette smoking, the single thing that you could do to reduce your risk of heart attacks and strokes, especially with diabetes, really highly recommended. And as you can see from this poster, the best results for quitting would be if you get a combination of specialist support and prescription medication to help you to quit. You can see the massive benefits within 20 minutes, but also the longer benefits. After 1 year after quitting smoking, the risk of a heart attack or stroke has dropped to half that of a smoker. At 5 years after quitting, your risk of a stroke is now the same as a non-smoker. So the sooner you do it, the better. D is for diet, the cornerstone of diabetes. There is no special diet required to prevent cardiovascular disease. It's healthy, balanced, eating regularly with an eye on portion control. It's very important that your diet suits you and your needs and your lifestyle. It should be something that you're both willing to do but also enjoy. Healthy, balanced diet should just be the same for everyone in your family. We will look at 2 examples: high fibre, low glycemic index, vegetables, fruit, whole grains, low fat dairy and oily fish. Watching out for saturated and trans fats. Omega-3 choices or the healthy fat choices, which are good for the heart and the blood vessels. This is the Eat Well guide, which basically highlights controlled amounts of carbohydrate, slow release form, high fibre, little refined sugar. The Mediterranean diet is also been shown to cause weight loss, prevent heart attacks and strokes and premature death, so I would really recommend looking at that further. And you can see lots of vegetables, maybe changing the way you think about meat, have it maybe in smaller portions. Same for dairy, small amounts of a variety of dairy products. Seafood twice a week, consider vegetarian meals 1 night a week, using good fats, and switching to the whole grains. For dessert, consider eating fresh fruit. Don't go without anything, have your sweets for special treats and celebrations as well. E is for exercise. Try to get exercise 30 minutes per day, 5 days a week. The important thing is to get moving. Walking is a suitable exercise for most people. So speak to your primary care provider if you need access to suitable exercise programs as well. There are a lot available. The result of the diet changes and exercise that we discussed should hopefully bring weight benefits. With diabetes, if you're overweight, you should aim to get 5 to 10% in initial weight loss, and those lifestyle changes should help. Keeping an eye on the waist is especially important for your cardiovascular risk as well, so find out what yours is and what the healthy waist circumference should be depending on you. So making the changes, it can be difficult. There's plenty of support available, local support, exercise referrals, sometimes psychological support is needed to help you find solutions to your problems. It can be individual or it can be group. They say that the onus should not be just on the patient to make the changes, and that maybe there's something that we need to do to help you in the practice in your local community, local forums, just whatever you need to help make the changes a bit easier. So, diabetes, on that note, should not be stressful. It's important to be relaxed, to feel in control, and to be setting your own goals. It shouldn't be complicated. It's basically healthy, nutrient balanced diet, moderate alcohol, regular eating, regular activity, and stress is a modifiable risk factor for heart disease in itself. So be self-aware of what's triggering your stress. Consider what helps to lower it. It might be a yoga class, tai chi, or another form of gentle exercise. But basically, don't be afraid to ask for help with your diabetes. Thank you.